What is diabetes mellitus? Why does diabetes occur? What are the first signs of diabetes mellitus? It is more important to prevent diabetes than to treat. Prevention is always better than cure. Vanakkam, I am Dr. Smitha, consultant internal medicine, diabetology and lifestyle medicine physician. I work at SIMS Hospital, Vadapalani. Today, let us try and answer some of the few common questions asked by patients for diabetes mellitus. What is diabetes mellitus? Diabetes mellitus is actually a group of metabolic disorders which the common abnormality in which is increased blood sugars. It is a combination of, it is a multifactorial disease and it affects due to genetic factors and environmental factors. So, நம்ம இப்போ diabetes na எப்படி diagnose பண்ணுவோம்? There are three main lab values. One is fasting blood sugar when it is more than 126 milligram per deciliter, and when HbA1c, which is 3 months average blood sugar, is greater than or equal to 6.5%, or when we do a oral glucose tolerance test, that is we give 75 grams of glucose to a person who is fasting, and after 2 hours we check the sugars, and if it is greater than 200 milligrams, we tell the person has diabetes mellitus. Why does diabetes occur? There are two important causes for diabetes, like when the insulin production in our body reduces. The insulin in our body is produced by beta cells in the pancreas. When these cells get destroyed or there is dysfunction of these cells, the insulin production comes down and our blood sugar increases. The other cause is increased insulin resistance. Insulin resistance is increased in cases of overweight or obesity, where there is lot of insulin production from the pancreas, but it is not utilized peripherally like the muscles or the tissues. These are the two main causes for diabetes mellitus. What are the first signs of diabetes mellitus? இப்போ பார்க்குறோன்னா நிறைய பேஷண்ட்ஸுக்கு symptoms இருக்காது, they will be asymptomatic. Initial many years they may not be having any symptoms of diabetes, but அவங்க blood sugars மட்டும் ஏறிட்டு தான் இருக்கும். When it is very high, they can have symptoms like ரொம்ப தண்ணி தாகமாக இருக்கிறது, யூரின் அடிக்கடி போகிற மாதிரி, இல்லை ரிக்கரண்ட்டாக urinary infections வரலாம், வாயில் white-ஆக deposits இருக்கலாம், that is also because of a fungal infection called as oral candidiasis. இந்த மாதிரி நிறைய symptoms இருக்கலாம், but most of the patients will not have symptoms, they will be asymptomatic. நம்ம எப்படி diagnose பண்ணுவோம்னா, sometimes if we are asking them to, like when many patients come for like master health checkups or preventive health checks, அப்போ asymptomatic-ஆக இருக்கிற patients we can detect faster and start the treatment faster. Then many times when they are doing blood tests for other conditions, like a person has come for myocardial infarction or a road traffic accident, அப்போ நம்ம routine மீதி tests பண்ணும்போது we find out that blood sugars are elevated. இன்னொரு விதத்தில் வருவாங்க, எப்படின்னா காம்ப்ளிகேஷன்ஸ் ஆஃப் டயபெட்டிஸ். நிறைய வாட்டி காலில் புண்ணு இருக்கலாம், அது ஹீல் ஆகாத இருக்கலாம், ஹீல் ஆகிறதுக்கு ஏதாவது புண்ணு வருதுன்னா பட் அதை ஹீல் ஆகிறதுக்கு ரொம்ப டைமாக இருக்கலாம். இந்த மாதிரி இருக்கும்போது these are also the complications of diabetes which can be detected when a patient has diabetes, which may be presenting as the first symptom of diabetes to a hospital. It is more important to prevent diabetes than to treat. Prevention is always better than cure. Prevention பண்றதுக்கு first we have to find out who are all at risk for developing diabetes. நிறைய ரிஸ்க் ஃபேக்டர்ஸ் இருக்கிறவங்க, இவங்கெல்லாம் யாருன்னா ப்ரீ டயபெட்டிஸ்னு ஒரு கண்டிஷன் இருக்குது. ப்ரீ டயபெட்டிஸ் இஸ் அகெயின் யூ கேன் டயக்னோஸ் பை மேக்கிங் த ஃபாஸ்டிங் blood sugar which should be greater than 100 milligram per deciliter, and HbA1c should be either equal to or greater than 5.7%, and 2 hours glucose tolerance test should be greater than 140 milligram per deciliter. In the mari patients, when we detect them faster, these people usually become diabetic sooner or later. Or 2-3 years they can become diabetic. So such patients, and also people who are overweight or obese, and people who had pregnant ladies who had a history of gestational diabetes, and people who have hypertension, cholesterol adhikama irukrom ivanga ella we should regularly annually screen for diabetes. So when these are the most important chunk of people who can become diabetic. So these people have to be targeted first. ivangala nama prevent diabetes prevent pandradhukku main thing what we should advise them is lifestyle modifications. Lifestyle modifications na physical activity, people who are mostly sedentary. Nowadays everyone is like sitting for a long time, either they are working from home, indha mari irukumbodhu we are sitting for long time, these are all the risk factors to develop diabetes. So idha nama cut pannanum. Plus the diet edukumbodhu in the low processed foods abdina natural foods, fruits and vegetables nariya eduthukanum. We should have less of highly processed foods. Highly processed foods na enna, nariya kolupu irukirathu, fatty foods, oily foods, sugar nariya add pannirukkirathu, fried items, idellame kammiya saapidum. So these who are all eating all these foods in high quantities, not exercising, these patients are more prone for diabetes. So these things have to be reduced, like eating excess of high calorie dense foods and not exercising. When we start making a good physical activity regimen and follow a balanced diet, we can prevent diabetes. And regular checks, if they have a family history of diabetes, we should always start checking at least annually the blood sugars. In this way we can prevent diabetes. Types of diabetes. Actually diabetes mellitus is a group of disorders. It is a metabolic disorder. In this we have, before it was classified as insulin dependent diabetes and insulin non dependent diabetes, but now this classification is no longer followed. We have a classification which has type 1 diabetes and type 2 diabetes. Type 1 diabetes is autoimmune condition. This affects mostly children and young adults, where the autoimmunity destroys the beta cells in the pancreas. Type 2 diabetes is the most common one, which we see in 95% of patients. This is because mostly of increased insulin resistance. This is seen in adults. They are mostly overweight and obese.